every which way. So thank you for joining us today. We have had some apologies that I've already noted. I can go back through them if you wish, but I don't really think that's necessary. We've got them down, haven't we? Okay then. So as we go through the meeting, if there are any declarations of interest, if you want to stop me, and we can work on those as we go along. Looking hopefully at the minutes, the matters for today, I don't believe that is going to be the case, but please stop me. And if we go straight over to the minutes of the last meeting, and I'm expecting you've all read them carefully, and I just need agreement that they're a true and accurate record of the day's proceedings. Yeah. I'm getting thumbs up and smiles. Thank you, everybody. Okay, so going on from that, we've got matters arising, and I think most things are on hold, and I've just conferred with Michelle to find out about the medicines safety programme that has been a topic of interest for us all. Just to say at this moment, naturally it's been deferred. It's not gone off the boil, but it's just deferred slightly because of vaccine requirements. So Laura Angus is working on that, and she's agreed to keep me informed anyway. So we'll work on that one. And if I just move swiftly on, really, and I'll let Simon take the floor, if that's okay. Over to you, Simon.
Yeah, as with previous months, the CCG's been what's called trued up to a break-even position in common with other NHS organisations. We expect that will continue for the remainder of this financial year. So for primary care, that's no different. We weren't allocated the full amount of monies for additional roles, but we are reimbursed when we recruit. So again, although that appears as a shortfall in funding, it technically isn't, because we will be reimbursed what we spend. Vaccinations is being rolled out. I understand some of those reimbursements and payments are not quite as quick as the primary care response has been, but we're working to support practices where we can, even though it's not necessarily the CCG's role so to do. It should be coming direct from NHSEI. But from a financial perspective, all is as previously reported. We're where we expected to be year to date, and continue to forecast a broadly break-even position for the year. That's probably all I'll say, Julie. Given we've only got an hour.
Thank you, Simon. Have we got any questions for Simon? Apologies, I don't seem to have a bar this morning that's telling me whether or not you've got your hands up, so we can do the old-fashioned way. David.
Yeah, could I just ask Simon, what about prescribing? It must be obviously a very difficult thing to keep track of with the current situation, but prescribing was starting to go above prediction before all this happened. Are we able to detect what's happening with prescribing, and is it still going to be an additional impact that we weren't planning before all this started?
Sorry, David, I missed the first bit of your question there. You broke up slightly.
Oh, sorry, yeah. About prescribing and the overall costs of prescribing,
yeah,
which have been made obviously more difficult to understand in the current situation.
No, I don't think there's any issue about understanding it. We are getting all the information we always got. The team are able to understand what's being prescribed and when. I suppose maybe you're thinking about have we been able to come up with savings schemes and implement them throughout the financial year? The answer to which is no. We weren't terribly successful last year, and we managed to bridge the shortfall in the planned prescribing savings through other means. We haven't been able to implement any meaningful savings plan this year, other than the generally good practice of our GP colleagues and pharmacists. That is part of the overall true-up exercise, so the funding that's nationally being put in place to support the health service. But there's no reduction in the level of data we get or the understanding the team has about who's prescribing what, where, and when.
Okay, thank you.
Any more questions for Simon? Tim?
Hi, Simon. It's just a small point, though. Just looking through, and I can see we're 51,000 underspent on anticoagulation local enhanced service. And most of that will be due to the fact that we were advised to switch as many of our patients from warfarin to DOACs when COVID started to reduce contacts, and it's been very successful. I just wondered if there were plans to reinvest that in other local enhanced services, because obviously that will be a sustained reduction now they've been switched off warfarin, or whether that would just go into the sort of great beyond.
There's no plans that I'm aware of, Tim, but lesers, as with other GP sources of income like QOF, are now subject to being guaranteed. So I'd expect that to flow into primary care on some basis. So
right, okay.
either actual activity that was undertaken in quarters 2 and 3, or the minimum of that, and what was earned last year. That's the way we've tried to approach lesers and QOF.
Yeah.
It shouldn't be a reduction in income.
No problems. Okay, thank you.
Right. Any more questions for Simon? I think from going on from this morning, and apologies to bring this up, Simon, I think one of the important things that I thought when I was reading the report was around that the CCG is still funding returners, GPs, despite the money not coming in governmentally. So I thought that was a really valuable decision to make, and just a wise decision.
Yeah, I suppose the NHS England and Improvement would say the CCG has been funded for that, even though it wasn't made explicit. But yes, we are, for those practices that have taken advantage of that scheme and have secured the services of a GP returning to practice, that will be supported up until the end of March. As to what happens beyond the end of March, we're not expecting a great deal of clarity before we get to March. Conversations with Treasury are still ongoing at the national level. We are expecting that the current arrangements will in some form continue into at least quarter 1 of the next financial year. There's a huge amount of vagueness in there, and a huge room for manoeuvre, but one thing that will be guaranteed is it won't be a return to normal operations from April. It will in some way be a continuation of the same.
Yeah, thank you. You've answered the second part of my question there as well, which was what after March, and I guess that there are a lot of things that we aren't going to know until after March. But I think the key thing is that we've got our eye on the ball there, and that's the important thing. So thank you, Simon.
Okay.
Right. Okay then. If we move on now to our next speakers, Sean, it's over to you, please, and you're going to give us a COVID update today.
Yeah, thanks, Julie. So I'll just explain basically what's developed and what's been set up in terms of the vaccination programme, and colleagues might want to kind of chip in as well at the end in terms of epidemiology, for the area, and clinical colleagues, what it feels like at the sharp end of this. But just to start off by saying a really big thank you to primary care colleagues, because they've done an amazing job at standing up these local vaccination services at very short notice, and have worked, extremely hard, extremely long hours to deliver these vaccines to our population. So we've set up a number of what are nationally called local vaccination services. So we've got sites in Pickering, which is looking after the Shah PCN. We've got Haxby Health Centre is looking after the Wone PCN patients. Poston Gate are looking after the Selby Town PCN. Tadcaster Health Centre is another site which is vaccinating patients from the Tadcaster and rural Selby PCN. And then we've got Nimbus Care working out of Askham Bar, who are vaccinating the patients from Priory Medical Group, York Medical Group, York City Centre and York East. So those sites have all been up and running, I think, since just before Christmas, when the vaccination programme started. I don't think I'm actually allowed to quote numbers probably in a public meeting due to some of the sensitivities around the vaccination programme, but just to say that all the vaccines that have come in to us via the supply chain have been put out to patients very quickly, very efficiently, and practices have really tried to stick to the priority cohorts that have been identified by the JCVI. So the current priorities are around the JCVI cohorts 1 to 4, which is number 1 is residents in care homes for over adults and the staff that work in those settings as well. Cohort 2 is patients of 80 years of age or over, and starting to look at the frontline health and social care workers. Cohort 3 is 75 years of age and over, and cohort 4 is 70 years and over and the clinically extremely vulnerable individuals. So there is a national target. Well, the target for care home residents was actually the 24th of January to complete all those vaccinations. And I can say quite confidently that we have vaccinated, or practices have vaccinated, all care home residents that they can, excluding those ones where there are currently outbreaks where they simply can't get into those care homes to do those vaccinations. So we're aware that there are a small number of care home residents still to do, and those vaccinations will be delivered as soon as it's safe to go back into those settings. The deadline for the wider cohorts 1 to 4 is the 15th of February. So at the moment, there's a huge amount of scrutiny nationally from NHS England around progress against vaccinating those cohorts. And in practical terms, there's a lot of work going on at the moment in terms of trying to link that into the supply chain. So I think it's probably fair to say that supply chain is developing in terms of vaccines. And whilst the sites have had, at this stage anyway, plenty of workforce and capability to deliver the vaccines, the constraining factor really has been the supply of vaccines in the country. And it's early days, so we understand that. But it does feel as though we're now moving into a situation where we're trying nationally to understand what the need is in each locality in terms of numbers in those cohorts that we still have to vaccinate, and matching the local vaccine supplies up to meet that. So that's the work that's happening this week. Just in terms of challenges, really, I mentioned supply chain already, but I think that's getting a little bit better. There have been some reports anecdotally that supplies may diminish in this patch over the next couple of weeks as they're sort of rebalanced out across the country to ensure that other areas have progressed to a similar sort of position as we have. But we're pushing really hard to get as many vaccines as we can. and with the national push around vaccinating cohorts 1 to 4 by the 15th of February, we need a fairly substantial supply of vaccines over the next 2 weeks to meet that target. So we're working closely with NHS England to try and put in the numbers into the planning system to ensure that we get those vaccines. And I think that's about it, really. Once we've done cohorts 1 to 4, and this is probably publicly accessible information, we'll probably have done about 55,000 registered patients across the patch, and on top of that, probably a chunk of frontline health and care staff as well. So I think it's been a really great effort from all concerned in both the local vaccination sites, the vaccination centre that Nimbus Care are running as well, and the hospital hub. So it feels as though the programme is progressing well, but there's still a long way to go. Any questions?
Can I just say thank you, Sean? Thank you for that report, and for everybody that's been involved in the planning, in the process, and in the delivery. Staff, and there's a huge raft of volunteers as well that I know are helping people. So thank you to everyone. If we can throw questions out for everyone. Sharon.
It's not a question really, just to add a little bit of information on figures that it is possible to share. And so as at the 26th of January, over 26,000 York residents had their first dose of the vaccination, which actually represents over 90% of over 80s. And so I would absolutely concur with what Sean has said, an amazing effort for everyone, really. And then just to say that we are working to try and divert staff to access vaccination at the hospital hub, as opposed to the vaccination centre at Askham Bar, so that the Askham Bar site can be protected as far as possible for residents. That's just something that I think probably most people are already aware of. In terms of a general COVID update, Julie, do you want me to say something about the epidemiology and where we are in terms of COVID in York?
Yes,
would that be helpful?
That would be really helpful. Thank you, Sharon.
Okay, so across North Yorkshire and York, we've seen a substantial fall in cases of COVID, which is very much to be welcomed. And so I think colleagues will all be aware that North Yorkshire and York, having been for quite a while at the bottom of the regional league table for positive cases of COVID, as a result of quite a significant spike round about Christmas and New Year. Both York and North Yorkshire catapulted to the top of the regional league table. York was at the top of that, followed by North Yorkshire. I'm very pleased to say that rates have fallen considerably across the patch since then. York's rates are not falling quite as quickly as North Yorkshire. So we still have a prevalence higher than the national average, but we're no longer the top of the league, and Bradford and Leeds and Rotherham are local authorities in the region that now have higher rates than York. So when we look at today's case rates, we're looking at a rate for York of 286.3 per 100,000 population, which is more than half of where we were, or less than half of where we were 2 weeks ago, which is very positive. At the peak, we reached the peak of cases around the 8th of January, then we were looking at around 1,400 new cases a week. Just to put that down, put that in context, we're now looking at 603 new cases over the last week. So great progress. But we know that rates can go up quickly as well as they come down quickly. So not complacent about that at all. The case numbers are still quite high in the over 60 age group, which is obviously an age group that we keep a very close eye on, because we know that there is a link to age in terms of the people that can become more sick as a result of COVID. That rate is falling, but not falling as quickly as I would like. And because the case numbers were so high, a couple of weeks ago, we're still seeing a lot of pressure on the NHS. So York Hospital still very busy. It looks as though those numbers are beginning to stabilise, but we're still keeping a very close eye on what's happening in terms of hospital activity. Our testing and contact tracing is going very well, and as we've already discussed, the vaccination programme is going very well. So all of our indicators are heading in the right direction at the moment, and a lot to be celebrated, but balance that against the fact that we're also starting to see an increase in the number of deaths. We knew this would happen. There is always a time lag with a number of deaths, but in the most recent week, we've seen 29 COVID deaths, which obviously is a concern. I would expect those numbers to go up slightly before they start to fall. So overall, a positive picture, but balanced against that sad loss of life that we're seeing as well. And then just to finish, one of the reasons we think North Yorkshire and York have seen such a spike in cases is we know that the new variant of the virus, which is more infectious, got into York and parts of North Yorkshire before it got into other parts of the region. So Harrogate, York, Harrogate, Cumbria, for example, that side of the country has seen very high percentage of cases due to the new variant. That variant is rapidly now becoming the dominant variant of the virus, and we're starting to see cases in other parts of the region as well. So I think we're keeping a very close eye on it, and we're not out of the woods yet in terms of COVID. And I very much hope that we don't see a lifting of restrictions just yet. And we're certainly making our representations to government that it's too soon to think about lifting restrictions in York and North Yorkshire at the moment. So I'll stop there, but obviously happy to take any questions.
Any questions or comments? Tim, have you anything to add here?
I've always got something to add, Julie. You know that. You only need to ask. Yeah, I mean, you know, just from a GP point of view, there is a lot of interest and anxiety around the vaccinations, understandably. I don't think this will come as news that the stuff that's shared centrally, often I'm hearing it for the first time on the BBC News, and that can sometimes cause issues, but we understand that and we have to live with that. There is a conflict at the moment, perhaps, between trying to meet this 15th of February target and vaccine supply. So I'm hearing what Sean's saying, but I'm actually sort of having an email conversation with the lead pharmacist of the site. and there's a slight divergence in confidence on supply. Hopefully that's not something confidential, but I think this is a national problem, and York is doing very well on a lot of the cohorts. So that just makes it really hard to plan. So I come in on Monday morning, not knowing whether I'm going to get any vaccine supply for my 300 patient clinic in Pocklington on Saturday. These patients then need to be rung individually and booked in. And I don't need to tell you that is an incredibly labour intensive process. Obviously there's online booking for the main centre, but there are patients, particularly in these age groups, who don't have mobile phones, don't have easy internet access or the sort of ability to use the booking thing. So it's been very intensive, and I think it will probably keep like that for a little bit longer until we get through the over 70s. One thing the CCG might be able to help with, and public health too, is there remains considerable confusion about the difference between clinically extremely vulnerable and clinically vulnerable. This perhaps is being fueled by individual lobby groups also lobbying to say they should be extremely vulnerable, not clinically vulnerable. And that does create pressure from extra phone calls coming through our lines with patients saying, well, am I clinically vulnerable or extremely clinically vulnerable? It's essentially cohort 4 or cohort 6. In reality, it probably makes a difference of about 3 or 4 weeks to get your vaccine, but that's a long time for these people. So any help that either the CCG or public health could give in getting that message out that we are getting to people, but there has to be order, and that's been designed nationally by the Joint Vaccination Committee. It's not really for local interpretation. I suppose it would be helpful just so that, you know, everybody's patients, will get to everybody, and just help managing that extra workload that it generates at practice level. So I think I'll stop now.
No, that's fine. Thank you, Tim. Sean, have you any response for that?
Yes, you have my sympathy, Tim, because a lot of emails are coming through to me on that topic as well. It's a difficult one, isn't it, in terms of messaging to the public, because everyone's obviously anxious and would like to have their vaccination now. We are trying to get those messages out, but happy to work with you, Tim, and you know, get. I mean, it's all very well if I say it. I think it's helpful to have local GPs working with us to get some of those messages across as well. But happy to, you know, put the council's communications team in touch with the CCG communications team and yourself to think about what more we can do to help get that messaging out. More than happy to support you with that, and it'll be an issue across the patch for all GP practices, I'm sure.
Yeah, thank you.
Sean, can I ask? Sorry, David, I know you're waiting patiently. Can I just ask Sean to come back on that one first?
Yeah, I mean, there is some national guidance in the Green Book, and there's a link through there to what actually defines that cohort of extremely clinically vulnerable. But I guess your average member of the public probably wouldn't be able to understand that because it's quite technical and clinical. So I think between us, we have to find a way of communicating with the public a level which they'll understand, which I think, as Tim says, getting into the detail of what is in each cohort is probably a little bit ambitious, but just to really reinforce the message that we're working through those priority cohorts in the right order, and we'll get round to people as soon as we can, as soon as we have sufficient supplies of vaccines. Those patients will be called in for vaccination. So I think that's the key thing to reinforce with patients.
It's about that reassurance, isn't it?
Yeah.
Thank you. David, thank you for waiting.
No, it's just a more general question, really, probably for Sharon. What's the view, Sharon, in the public health world about the progression of the virus. If we're in wave 3 now, is there going to be a wave 4 or 5 or, I mean, obviously you haven't got a crystal ball, but what's the view within public health about where things are taking us?
So that's a very good question. What we're seeing at the moment is that the lockdown that we're in at the moment is working in bringing the case numbers down. However, we're not really seeing a tremendous lifting of pressure on the NHS. And so even though the numbers are coming down, we have a long way yet to go. And vaccination will obviously help, but vaccination is only one tool that we have to manage this pandemic. We don't yet know whether vaccination will prevent somebody from passing on the virus to someone else, for example. So from a public health point of view, we feel very strongly that lockdown measures need to continue. We need to monitor very carefully what's happening with the NHS. And if pressures remain on the NHS, then we would be encouraging the government to review current restrictions and whether they are sufficient to be able to allow the NHS to get back on an even footing. And that we know what happens when you lift national restrictions too soon. We've seen that, and it creates a massive spike. And so vaccination program, keeping up the efforts on that, but also keeping those infection control measures around, people maintaining distancing, wearing face coverings, hand washing, getting tested, self-isolating if you test positive, the tried and tested work that we do in public health around testing and contact tracing, trying to isolate people and prevent the transmission of the virus, all needs to happen as well. And if we can step up testing and contact tracing, give adequate support to people so that they can go into quarantine themselves rather than feeling as though they can't afford to do that and they have to go to work. And then keeping a close eye on national measures that need to still be in place. I know those are the things that people don't want to hear. They want to hear that vaccination is going to get us out of this. But I'm afraid vaccination alone will not get us out of this. And so I think we're going to be living with this virus and facing some kind of restrictions on our everyday life, at least until the autumn would be my view, before we can be sure that we've actually got the pandemic under control.
Yeah, thank you.
Thank you, Sharon. Is that okay, David?
Yeah, it's
lovely. Thank you.
Yeah.
Any more comments, questions, Phil?
Thanks, Julie. Hi, everybody. Just in terms of vaccine, Julie, I wonder whether this committee could recommend to the Vale of York governing body next week that the governing body formally writes to those leading the vaccination programme within the Vale of York to recognise the outstanding work that they've done so far, as Sean described, and to sincerely thank them for the work that they have done and continue to do. I think it would be right and appropriate if you were able to make that recommendation into governing body next week, please. Thank you.
Thank you, Phil. Most certainly will do. Any more comments? It's clear we're well not out of the woods when we look at where we are. I'd like to remain positive, but as Sharon said, we're still getting a high percentage of deaths, and that will happen for some time. But I'd like to sort of think about the positive things that we can do, which we've talked about this afternoon, and that will be good communication. So it's getting that correct message out and doing that jointly. So from public health, from the CCG, so all of us coming together, remembering to be kind to everybody, and giving appropriate, timely information. Tim said that he hears things on the news, and I think a lot of us do, and it comes through at something stupid o'clock, like 10, 11 o'clock on the news. And it must be unbelievably scary for lonely, isolated people living out in the countryside with nobody to turn to, nobody to talk to. And if we can get that message across of, you know, take time, breathe, think about it, we'll get the right information to you. We are doing everything that we can to take care of you, your health and your well-being. To me, that's really, really important, but it is about good communication that we need to take forward. And Phil Metton, you've hit the nail on the head. We are working really, really hard together. And I'd like to add to that, we're doing some positive things. If you look at some of the interactions that people are having, some of the clever things that people are doing for people post-COVID, so when they're recovering, talking to them in a way that helps them with the recovery. So giving them permission to take a step at a time rather than run a marathon. There was I don't know whether it was a GP, there was a GP and an epidemiologist talking today, and the GP was a marathon runner and she wanted to run the marathon, and their recovery might be slower, and somehow I'd like to give them that message that it might be a little bit slower, your recovery, but actually you will get there. And using different tools, things like singing to improve. There's an opera singer using the internet as a way of reaching out to people. So it's us reaching out to those people that we care about, and sending out a really positive message. I wanted to end on something that is positive, as well as how absolute in awe of I am of the services that I've pulled together to get the vaccination programme done. Our GP practices, our colleagues in health, our colleagues in local authority, and our CCG colleagues, all of whom I know working round the clock. And I'd say just look after yourselves too, please. Thank you all. I know it's been a very short meeting. Anything else that anybody would like to say before I close the meeting? Okay, so I'll say thank you to everybody. Have a really good rest of the afternoon. I'm here if anybody wants to get hold of me about anything else, just to drop me an email. And our next meeting is the 25th of March at 1:30. So I look forward to seeing you all then. Stay safe. Remember distance, hand washing, and all of the mask wearings, all of the wonderful, beautiful coloured masks that you can find. Put one on, it'll make you smile. But take care of yourselves. Okay, thank you everyone. Bye.